Hey, guess who it is, everybody? Jason Goodwin, and I'm here to talk to you about clinical judgment and critical thinking. This is chapter 2 of the Wilkinson's Fundamental of Nursing book, Davis Advantage, and this is edition 5, I believe. I have to check on that. It is fifth edition. That's right. So we're going to talk about this, and we'll get started right away. All right. So what does nursing involve? It involves thinking, doing, and caring, right? I don't think I need to explain what those are, but when you're talking about thinking, which is the foundation of being activity oriented, right? You're thinking about what you're going to be doing, and then you are doing that, of course. And then the more that you're doing that, there's another way to describe when you're doing nursing. It involves thinking, doing, and then of course caring, which is oriented to someone individually, right? So we do all three, and there are a couple things that have a underlying foundation of clinical judgment. One is the NCSBN, and in 2019, they acknowledged that clinical judgment integrates critical thinking and decision making. So nurses, they apply knowledge to observe and access presenting situations and identify a prioritize client concern, thereby generating the best positive evidence-based solutions in order to deliver safe client care. Okay, that's in the book. Tanner also says that it defines clinical judgment as the interpretation or conclusion about a client's needs, concerns, or health problems. Okay, and then the decision to take action or not, and use or modify standard approaches, improvise, or other things as deemed appropriate by the patient's response. That's a lot, right? It emphasizes the importance of the understanding of the disease process, pathophysiology, diagnostic aspects, and the impact of the illness experience from the client and the family. And then Benner, Tanner, and Chelsea in 2009, you've heard of Benner probably, note that clinical judgment are the ways in which nurses understand the problems, issues, or concerns of a client or patients, to attend to the salient information, the important information, and to respond in concerned and involved ways. Okay. As an integral part of this definition, of course, is the process of acquiring, analyzing, and using information to address clients' needs. It's important that you understand, and it might even be on the test, that critical thinking is to be used in every aspect of the nursing process, right? Assessment, diagnosis, plan, intervention, and evaluation. All right. And so we're going to use that in every aspect on top of the nursing process that we use, which is, of course, used because it can help us identify multiple problems and prioritize that in our patients. Okay, so different types of nursing knowledge. So there's lots of different types. One of them you could describe as theoretical knowledge, right? And this has to do with the facts and principles and evidence-based theories, the things that we've spent a lot of time acquiring so far, physiology, even psychology. Use a lot of psychology in our job. But it includes a lot of rationally constructed explanations and research findings and to explain phenomena. It also helps us understand the disease process, the medical treatment, including things like dietary, medications, activity, surgical treatment, and then as it all pertains to client and family factors. So this is all the theory behind what we're learning and the reasoning why you might choose certain interventions and predict client responses, okay? The practical knowledge is knowing what to do and how to do it. So you not only have that theoretical background, but you also have the actual knowledge of the decision process, the procedures, the understanding of the how and why, and how to correctly perform those skills. All right, and then finally, or secondly, self-knowledge. Thirdly, self-knowledge to think critically. You have to be aware of your beliefs, and so your self-knowledge is going to drive that, right? And you can gain that by developing personal awareness and reflecting on, everything that you do, right? Why did I do that? How did I develop that thought process? We talk about rationale. So we talk about that's, what was the thought behind that? What were you thinking? And what made you choose that? So the more you understand that, the better. Ethical knowledge, and that's consists of information about moral principles and processes for making your decisions. It helps us fulfill our ethical obligations to clients and colleagues, and incidentally, is part of our professional identity, right? So it's very important. Okay, I'm lost here. Hang on. Okay, so next slide. Hang on one sec here, guys. Okay, clicker check. Which type of nursing knowledge requires an understanding of the pathophysiology of the disease process, medical treatment, and client and family factors? So we can go through this and probably figure some things out by looking through the answers, right? Number one, what do we think? Is it practical knowledge? Is it self-knowledge, ethical knowledge, or theoretical knowledge? So, which type of nursing knowledge requires understanding of the pathophysiology, medical treatment? Okay, so this is more technical in nature. So maybe the self and the ethical knowledge might be some that we throw out. What do you guys think? So then that leaves us with practical knowledge or theoretical knowledge. You could decide which is which. I'm going to go with D, and that is correct. Theoretical knowledge is understanding why to gain a strong foundation for analysis and synthesis of data. Okay. So it consists of the facts, principles, and evidence, right? We talked about that as the beginning. Okay, a couple of models of clinical judgment. So in nursing school, we have models that we use to teach you this stuff, right? And so there's a couple of these in the book. One of them is called the Tanner model, and it has a bunch of different, well, 4 different aspects. Okay, so number one is noticing. So this entails performing an impression of the client situation, and it has to do with your expectation and knowledge, and then past experiences with similar clients. Okay, and it also integrates your theoretical or textbook knowledge and the work environment, including work culture, facility patterns of care, everything else. Okay, so noticing. And then once you do that, interpreting is the reasoning process behind your initial clinical situation. Okay, so it's analytical, it's intuitive, it's narrative. So, how did you interpret what you first noticed? Responding is the course of action that you take, right? You respond to what you see after you've interpreted it. And then reflection is you've responded and you've taken action. What exactly are you, how was the effect of what you put in place? A reflection in action is used during the actual act, right? You're evaluating things in real time, and then a reflection on action is an after action report, right? It's after everything happened, and you reflect on what you could do for the future. There's another one. It's called the LCJR, Lassiter Clinical Judgment Rubric. Now we know what a rubric is by now. Probably a rubric is just an objectified set for grading so that we can make sure that we're giving grading according to certain principles. All right. So it identifies 11 dimensions that are used to measure each of the 4 aspects of Tanner's CJM. And it categorizes the progressive development of clinical judgment in each dimension. And so it starts at beginning, developing, accomplished, and exemplary. So the rubric assigns a rank of 1 to 4. And the 11 dimensions, it's broken down, and the simulation scenario is usually, or an actual clinical experience is part of it. And the participant's development is scored in 4 different ways. And so up to 1 to 11 is beginning, 12 to 22 is developing, accomplished is 23 to 33, and exemplary is 34 to 44. Okay, and that was developed in 2007. All right, so the NC-BSN, the clinical judgment model, this measures whether a test taker has the established degree of clinical judgment and decision-making abilities to be a safe practitioner. This is part of the NCLEX theory, right? And so it helps you to recognize and analyze, organize and prioritize, and use your knowledge to make safe clinical care decisions. And this is important because, as I said, it's going to be the model that the NCLEX uses. So there are 4 layers to it, and the first layer is actually 0, and it contains clinical decisions made by the nurse to address the client needs. Okay, client decisions. Second is comprises the outcome. This is just clinical judgment. And layer 2 involves forming and redefining, prioritizing, and evaluating hypotheses in order to achieve desired outcomes. And so this might involve repeated cycles, depends on one's experience level. So when you're evaluating a hypothesis, this is part of the scientific method, right? And so this is part of integrating that. And then layer 3, actually there's 5, I said 4 layers, there's 5, including 0. Layer 3 requires you to have a solid knowledge base in order to recognize patterns. So we're analyzing that, understanding connections between cues, examining pathophysiological processes, organizing data, right? We're relating the pathophysiology in our mind map and things like that. We're relating it back to the client's problems. It involves independent, recurring, and repetitive processes of recognizing and analyzing cues from signs and symptoms and medical history and all those types of things to form and refine our hypothesis from layer 2. Okay, so we're going to form and regenerate that if necessary. Then once that's satisfied and the actions are implemented and outcomes are evaluated, as you know, as you're hearing, these are all part of the nursing process, right? Layer 4 is what gives us context. So identifies individual and environmental factors that can impact the nurse's reasoning or cognitive processes. Okay. So what's the process of noticing? Is that developing an impression of a client situation based on nurse's expectation, knowledge, and past experiences? Is it the course of action taken by the nurse? Is it the process of examining the actions implemented? Or is it the reasoning process nurses use to make a sense of the initial clinical situation? Okay, so a couple important STEM words here and things we should focus on. Well, first of all, noticing is an early part of the process. I remember that for sure, right? So initial clinical situation sticks out. Okay, the process of examining the actions implemented, that's a little further down the road. The course of action taken by the nurse, that's action. That's a little bit further, I think. So now we have A and D to go for, right? Developing an impression of the client based on the nurse's expectation, knowledge, and past experiences. Developing an impression. Okay, impression and initial situation, those are pretty early. So I'm going to go with A because I remember some of the definitions that we talked about. Let's see. Yeah, so A is the impression of the client situation based on all of these things. Okay, but that's an initial assessment, right? Something you're going to notice. Okay, so clinical reasoning. This is the process of synthesizing knowledge from numerous sources and developing a plan based on a particular scenario or client. All right. In essence, it's the application of knowledge, information from various sources and experience to a situation, and that helps us make judgments, generate alternatives, or evaluate action based on evidence and select the most appropriate action based on those scenarios. It requires reliance on your knowledge and experience to form a conceptual image of the problem and effective management. Okay, this comes with time. That's why we always talk about the repetitions being so important. Importance of clinical reasoning. This is an essential component of developing clinical judgment. Of course, the practice of professional nursing requires these skills because it's a rapidly changing, complex environment. We know that already, right? And in order to teach someone that process, there has to be a framework in order to do that. And so that's what we do. Ineffective clinical reasoning skills is a major factor in error and in the failure of nurses to respond to deteriorating client conditions. So that's why we focus so much on those clinical reasoning skills and teaching you how to do that, because we don't know when you're going to need it. And when you do, it's going to be pretty important, right? Okay. So critical thinking is it's a combination of things. All right. It's a combination of reasoned thinking, openness to alternatives, the ability to reflect, and a desire for truth. Critical thinkers are flexible, we're non-judgmental, inquisitive, and honest, and interested in seeking the truth ultimately. We possess intellectual skills that allow us to use our curiosity to our advantage and to have critical attitudes that motivate us towards using those skills responsibly. And that's part of our developing our professional identity, right? Okay, what's the most correct definition of critical thinking? A problem solving process that enables one to show others they are wrong. Okay, I can tell you that's probably not right. Number two, be an examination of one's own beliefs in order to defend them intelligently. Okay, let's hang on to that. C, purposeful analytical thinking that results in reasoned decision. That sounds pretty good. And four, rational thinking that results in obtaining the one correct answer. Now, we know that there's not just one correct answer most of the time, right? So let's throw two out. What do you say? Let's throw A and D out. Okay. So in order to defend them intelligently, I don't know about it. Seems like there's not the curiosity that we talked about. The one that does purposeful analytical thinking that results in a reasoned decision. To me, that seems like a very measured answer. I think I'm going to go with that one. There you go. So it's not used exclusively to defend one's beliefs, and it shouldn't enable a person to see that there's only one answer. There should be more than one answer, usually, right? If there wasn't, then the NCLEX would be a lot easier. Okay, so what are the critical thinking skills? Skills in critical thinking are referring to our cognitive and intellectual processes used in complex thinking operations, right? Like problem solving and decision making. When planning our care, we gather information about the client and draw conclusions about the meaning of that information in order to identify the client's problems. All right. You might think of several actions they might take to help solve or relieve a problem, right? And then if problem solving is well, let me skip on to that. And let's give some examples of critical thinking skills. So on the next slide, we'll talk about some examples of these, and that'll be easier to understand. All right, so organizing and grouping information in meaningful ways, okay? Making inferences, so tentative conclusions about meaning, visualizing potential solutions to a problem, exploring the advantages, disadvantages, and consequences of each potential action, evaluating the credibility and usefulness of sources of information, recognizing differences and similarities among things or situations, and prioritizing or ranking data as needed. All of these are things that you're doing, and then you're constantly examining and re-examining to make sure that if there is some sort of an assumption that doesn't turn out to be true, then you identify that, right? What are some of the attitudes? So attitudes aren't the same as intellectual skills, right? They're more emotional, more like feelings and states of mind. So you have to understand that your attitudes and character can also determine whether you will use your thinking skills fairly and with an open mind. So without a critical attitude, people tend to use thinking skills to justify, one way thinking, right, or to prejudge something and to create bias to benefit themselves rather than others. So that's an innate human characteristic, and so without a critical attitude, you're not examining those things, right? So just keep that in mind. So some of the things that are included in that intellectual autonomy. So you're an independent thinker. Intellectual curiosity. So you don't just take things for face value and accept them without understanding the background and the rationale behind them, right? Intellectual humility, understanding that you don't know everything and that there's always, the more you learn, the more there is to learn. Intellectual empathy, that's understanding how, different intellects and different assessments and perspectives can play into different levels of thought. Intellectual perseverance. So this is an example of something like, for instance, maybe you have a problem that you can't solve, and you could just overlook it in the hospital, right? Like maybe there's an issue that needs to be addressed, and you're having a difficult time with a physician getting it addressed, right? For whatever reason. The intellectual perseverance comes in when you understand that solving that problem is paramount and you don't let it slide, right? And so that's the perseverance we talked about. The fair-mindedness is just keeping yourself objective. And then confidence in reasoning is having a system of reason, a rationale, and then being able to follow that. And that can create confidence in your likelihood of feeling like you have the right answer, right? Okay. So why is this important for us? Why as nurses? Well, so we face complex situations, right? Critical thinking enables us to assess the client and family's beliefs, adapt the care so that it's culturally sensitive in response to their needs. Every client is unique. So nursing is applied as a discipline, but we must apply our knowledge, not just memorize and regurgitate facts, right? So we use knowledge from other fields. We use things like chemistry, physiology, psychology, social sciences, and many other disciplines. But that's just some of the things that we do. Nursing is very fast paced. The client's condition can change every hour, every minute, right? So we have to be able to critically think in order to respond appropriately, and in some cases with multiple scenarios under stress. Okay, clicker check. A nurse who is newly employed at a hospital questions a standard of client care that does not seem to follow evidence-based practice. Which critical thinking attitude is the nurse demonstrating? This would be intellectual autonomy, intellectual humility, intellectual courage, or fair-mindedness. Well, let's see. So intellectual humility, I'm not sure if that would apply to this. Humility doesn't seem like it's described specifically. And then fair-mindedness, questions a standard of client care. I don't know about that. My gut tells me, but let's say I'll go with either A or C, intellectual courage or intellectual autonomy. Let's check it out. Okay, it's A. The key point in the slide is that critical thinkers are not afraid to question things, right? So that they're not going to proceed with something just because that's the way it's always been done. So that's what we mean when we say an intellectual. What was it? Intellectual autonomy. All right. Great job. Okay, critical thinking model. So this is a 5-step process, and the model is used throughout the book. It provides more than one way of making sense of critical thinking, right? Or it provides one way. There's more than one way, but this model organizes it into 5 major categories. It's not meant to be an all-inclusive model, okay? It's just a guide and a framework when used when facing clinical decisions or situations that you're unfamiliar with. So using this is a system that will help you achieve good outcomes for your clients. So it includes contextual awareness, inquiry, considering alternatives, analyzing assumptions, reflecting skeptically, and deciding what to do. And so here we see the graphic of this. You'll see that, let's see, I'm going to look down here. So you have at the top contextual awareness, to the right, analyzing assumptions, exploring alternatives, using credible sources, and then redirecting and deciding. And then within that, there's a Venn diagram that explains our nursing process, right? And here we are again, a critical thinking model that integrates with our existing nursing process. All right. And so if you take a look at these and you just think about what the words mean, it's pretty easy to understand what this is trying to accomplish. It's just similar ways of approaching problems within the framework that we already use. Okay. This is the relationship between the nursing process and critical thinking. Okay, so the nursing process correlates and overlaps with all of those judgments as we talked about, and it helps us facilitate clinical decision making, and it also guides our reasoning. We learned this in the nursing process, right, earlier in the semester. So what is caring? We talked about caring early, but caring involves a lot more than what we just say, right? Nursing, I'm caring for a patient. Well, that involves personal concern for people or things or projects or events. It allows us to connect with our patients or others and give help as well as receive help. One aspect of self knowledge is to be aware of what and whom you care about, and knowing what that client wants and cares is reveals is what's stressful for the client, so that we can help understand what things matter to them and what can create stress for them, right? So it also enables us to notice which interventions as we implement those care aspects are effective. Components of caring. So knowing, being with, doing for, enabling, and maintaining belief. The components of caring are also, we're going to talk about them in a couple of slides, but these are the 5 within caring. Now, here's the full spectrum. We talked about this at the very first slide. What's the full spectrum nursing? It's a unique blend of thinking, doing, and caring for the purpose of affecting good outcomes from a client situation, okay? So the model concepts, we talked about this earlier, thinking, doing, caring, and the client situation. We're going to go into that. And so you're going to use critical thinking in all of these steps. And all of this is important that we motivate and facilitate the thinking and doing. And the goal of all of this is to have a positive effect ultimately on the client's health outcomes. Okay, so and that's what this shows. So you have the thinking, doing, caring, going into the client situation, and it creates a rainbow of spectrum of client outcomes. And we use this model to affect a positive outcome on that other end. How does it work? Well, first of all, using critical thinking with this enables us to fully exploit our knowledge and skills, right? And so we're optimizing that ability. The theoretical knowledge are the principles, facts, and theories that you have to think with. And then the practical knowledge is, as we talked about before, the skills, procedures, and processes, including the nursing process. And then we talk about the process in doing, and that's the assessment and evaluation. Okay, so everything you know about the client, including context, planning and implementation, and what you do for the client. So as you notice, when we're talking about this, there's an overlapping theme, right? And so you just have to understand that this is the model that helps you overlay that to optimize the findings for your care. Okay. All right, clicker check. College courses such as microbiology, human growth and development, present content that is considered part of theoretical nursing knowledge. True or false? Well, theoretical knowledge, yeah, that's all the underlying foundation, isn't it? So I would choose A for that. True. It's true. Knowledge gains in these courses helps nurse develop more holistic and complete plan of care. Awesome. Okay, so critical thinking. It's a pleasant Sunday afternoon, and you are meeting with an old friend whom you have not seen in 2 years. She says, I hear you've decided to be a nurse. What made you choose that? How would you reply to her question? Well, so the way we would reply to that has to do with people in our lives that may have influenced us, how they identify who influenced our decision to become a nurse, right? And so a lot of these things we've thought about before, but we use critical thinking to answer that question. And we all have our own explanation. My answer to that would be, my answer to that question would be I was a lifeguard in high school at a water slide. I got to see EMTs and how they worked. When I joined the military, I thought I wanted to be a physical therapist, but I got a chance to have a nursing scholarship, and I decided that was close enough to what I wanted to do. And luckily for me, that was the right answer. It's been nothing but fun ever since. So that's my story. And then finally, critical thinking. Sorry. There we go. Socratic reasoning. As a client, which safe. Okay. So that's the end of our material today. I hope that you've enjoyed it. And I think that if you pay attention to what's been presented here, you'll do well on the exam, hopefully. And don't forget to read the rest of the book as well. And I wish you guys good luck. Take care.